that line or two that saved my life. It was that attention to detail that saved my life.
What's that?
My memory. I'm going to pull a list of all your sold customers. I was working at my Chevy store, and I had just gotten off the phone, and I collapsed mid-sentence.
I heard him on the phone, and he was sounding pretty stressed, but I was continuing to make my phone calls. Minutes after, I didn't hear anything, and then I heard a loud bang. So I turned around, and I walked back, and he was on the floor attempting to get up, but he couldn't really make it. So I reached down, I picked him up, and as I picked him up, I noticed that he was wobbly on his feet. I checked to see if he had hit his head or anything. That wasn't the issue. I noticed that his eyes were not focused, and he was saying, "Thanks, Rick, for helping me out," but he was slurring his words. Also, his eyes would not stay put. I yelled to the guys at the desk, "Somebody call 911, Phil's having a stroke."
The day that Mr. Walhart came to St. Francis Hospital, a stroke activation was called. When he came in, his pupils were fixed and dilated, he was posturing, and he was actually unable to breathe on his own. He was intubated.
So immediately the possibility of a neurologic event causing this certainly crossed my mind.
I knew right away that something catastrophic had happened. I was at the monitor, looking at the case, and just immediately I knew that this was extraordinarily serious. And then I immediately got on the phone to the neurointerventionists to let them know that they had a potential case that they should come in right away.
When I got there, he had an occlusion in the basilar artery. Basilar artery is the artery in the back of your brainstem. It provides the blood for the vital functionings of your brain, of your mind, of your ability to move, to talk, consciousness, your person, who you are. And when a basilar artery gets occluded, there's a very high mortality rate if we can't open it up. And it's devastating. When I saw him, he wasn't sedated and he wasn't moving. And even more concerning, he wasn't responding when painful stimuli was given. I spoke to his family. I told them it was a grave situation, that he could die.
He was still in a coma. He was going to die. He was very close to having a fatal stroke. Luckily, we have a cath lab that's capable of treating stroke patients in a comparable way that we do for heart attack patients.
What we did next was we put a special device called a penumbra catheter. We threaded up to the level of the occlusion in the back of the brain. We applied a suction device. And when you turn it on, it suctions and you can see blood is coming out, but as you oppose that catheter to the clot, the suction return should stop. And I noticed that it stopped, and at that point I was very hopeful that we had had the clot. As per the standard protocol, I waited a few minutes, and then you kind of slowly pull this down, and I took it out, and indeed there was actually a clot there. When I did a repeat angiogram, the blood vessels that hadn't shown earlier when I imaged them were there. And then a few minutes later, we noticed on the table, as we loosened the sedation, he began to move. What was even more amazing is that I went up to him and I said, "Phil, can you move your right arm?" And he moved his right arm. I said, "Can you move your left arm?" He moved his left arm. And at that point, I was very confident that we had not just opened it up, but opened it up in time. There are certain patients like Phil that have a Lazarus effect, in which the brain is stunned, but not yet dead.
All I know is I went down, and I'm alive. My message to the doctors, to the nurses, to the administrators, to everybody that worked on me. You followed the protocol, you identified what the opportunity was, you used some of the latest and greatest surgical procedures, and you kept me alive. For that, I'm forever grateful.